Posterior ligamentous complex, also known as PLC injury, is a tear or rupture of the posterior spinal ligamentous complex. This complex consists of the ligamental flavum, supraspinous ligament, interspinous ligament, and the facet joint capsule. This is also called the osteoligamentous complex. These injuries typically occur in the thoracolumbar region of the spine. The PLC acts as a major stabilizer in the spine. Its main purpose is to limit flexion and axial rotation and distraction of the spine. All of these increase stability and reduce axial load on the intervertebral disc. When a PLC injury occurs, this causes severe spinal instability to the patient. An injury to the posterior ligament complex can be caused by trauma or repetitive action of lifting and turning with heavy weights. This is not a common type of injury that can occur. Typically, it will be a compressed disc or a pinched nerve that the patient will have, but in some cases, a PLC injury may result because of this trauma. An examination will be performed to identify if a posterior ligamentous injury has occurred after a trauma like a motor vehicle accident. A physical examination will be performed, and the patient may present with palpable interspinous defect or focal posterior tenderness. As stated, this will severely limit the patient's ability to move in a flexion or extension motion in any axial rotation or turning. For a posterior ligamentous complex injury is suspected, a diagnostic X-ray is considered outdated, but in most cases, a doctor will want the initial X-rays used for a comparison alongside the MRI and CT. In most cases, a CT will be the first line of images for a spinal study due to the fact that a CT can detect any, if any, affirmation signs that can also be visualized on diagnostic X-rays, but with greater quality and detail. A CT sagittal view of the lumbar spine is seen all the way to the right of this slide. This image shows the enlarged space between T11 and 12, and the fluid can be seen disrupting down to L1. MRI will be used to directly evaluate the PLC by using these different protocols. A T1 view will show a disruption of the hypotenuse band, also known as the black stripe, of the ligament of the sagittal and on sagittal slices. The T2-FS or STIR protocol will show edema in regions of the posterior ligament complex elements on the sagittal slices. T2 will also show the facet fluid on axial images and the disruption of the hypotenuse band, again the black stripe, of the ligaments on the sagittal view. The STIR and T2 exams can be seen on the slide with the first two images to the left, with the fluid buildup disruption of the hypotenuse band on T11 and T12. When it comes to treatment plans, long-term complications can arise from not treating the PLC injury due to instability it causes to the spine. Typical treatment plans include spinal fusions with spinal screws, and sometimes they will need a disc spacer placed as well, depending on the injury. This is typically the route of treatment. There are times a fusion is not needed and only column support is placed. In some cases, the hardware can be removed once the spine has fully healed itself, but is not always the case due to some patients do not wish to undergo surgery to remove the hardware. But most patients can continue with a normal day-to-day life once they have fully recovered and typically do not have many issues following.